chat, yes. Thank you. And I'm going to hand over to Shirley.
Okay. Well, first of all, thank you very much for joining us. And I'm going to give you a little bit of information tonight about the male menopause. Now, you basically know any men, maybe between the ages of about 30, well, and interestingly, the research is now showing it's older, so 30 to 70, who have maybe starting behaving out of character. And if so, then you may learn something this evening which may help you and possibly them. Now, I am just going to put some information out there, but just to let you know, I'm not medically qualified. I am a coach, and I work with menopausal men and women, and this is just information that I have learned going along the way. So although this is research that's sort of generally out there, you know, if you've got any particular medical questions, then please, you know, go to somebody that's medically trained. So, oh, hang on, maybe I've lost this. Okay, so yeah, I've gone too far. So I'm just going to give you very briefly a little bit about me and why I'm here talking about the menopause. So Sarah's already said I'm an NLP coach and a hypnotherapist, and I'm very much about making the menopause a positive experience. Now, whilst I was studying NLP, I actually realised that I was menopausal, and I found that many of the techniques really helped me, and I recognised that they could really help others. So what I discovered going through my own menopause is it was much harder than I ever anticipated. I was very naive, I think. I thought it would just like, I don't know, something that maybe happened overnight and that would be it, but it wasn't. It's been quite a difficult transition for me, and I've actually found it really hard to talk about it to other people, even good friends, you know, wouldn't talk about it. So that is one of the reasons why I'm really sort of wanted to set up a coaching business as well to help other people. And I've also got 2 grown-up daughters, so I really didn't want it to be the same, you know, when they were my age as well. And I also want to make it a less taboo subject, because although things have really, really improved for the last couple of years with the Davina McCall program, it is still very much, you know, something that some people really find it difficult to talk about. And it's really the psychological side of the menopause, all stages actually, that I work with, because many people are aware there are physical symptoms with the menopause, but not so much about the psychological side of it. And up to 70% of women who are going through the menopause experience some kind of mental health issue. And I've also discovered that's very similar with men as well, actually. And I work with things like stress, self-esteem, anxiety, and low mood and things like that. And what I realized talking to women who are going through the menopause is that a lot of them said, I know that I've, you know, going through changes, but I think something's happening to the men around me that are similar ages. And that could be like a partner or a business colleague or a relative or something like that. And at first I just dismissed it and I thought, oh yeah, you know, that's a coincidence sort of thing. But the more people that said it, the more I thought, well, this is really interesting. Maybe there is something in it. And that's when I started to do some research, and I actually started researching and I found out that, yeah, actually there is a male menopause. So that's what I'm going to give you a very brief sort of overview tonight. So when men, well, actually there's lots of, there's actually not that much information out there, and what it is, it's conflicting. But when men are around their 40s, and it could be as early as from their early 30s, they start losing testosterone. And we all know that testosterone is the main hormone in men. They lose it at about 1% a year. So it's much less pronounced than it is with women. When women go through a menopause, it's over a much shorter duration of time. And for men, it can take like 15, 20 years even. It's not usually known as the male menopause. In the medical terms, that's what they don't like that name. They tend to call it the andropause, or testosterone deficiency syndrome, or late onset hypogonadism. I think that I pronounced that right. So, so for a woman, the menopause is 12, it's just that one day, it's 12 months after their last period. But with men, it's much more difficult to identify because they are always producing some testosterone. They never don't produce any. They can still sort of father children even when they're older. So it's just the amount that goes down. And with the andropause, that's just what I'm going to call it because it's easier. I can't get my mouth around some of the other ones. It's difficult because they don't, it's not all men are going to have experience problems. So the testosterone levels will fall in every man, but for a lot of them, it's not really a problem because it's so gradual. But for some men, and there again, there's conflicting research on this. Some say it's only 2% of men, some say it's up to 30% of men, but because there's not enough research, we don't really know. But when they start getting symptoms, it's they kind of sometimes call it low T as well. But it's basically, so when women go through the menopause, they will actually reduce their estrogen by 90 to 95%. So we've got hardly any estrogen left. Now, when men starting going through the andropause, they probably only get a sort of 10% decrease over a decade. So it's very, very gradual. But with men, one of the reasons why they get symptoms is because their testosterone is falling, but their estrogen is actually rising. So when we, so how do you necessarily identify that a man has got less testosterone and is experiencing symptoms? So these are some of the common ones. And as with female menopause, one of the things about it is it's very difficult because it's going to be very different, very unique for every person, and that's male or female. So there isn't one necessarily one size fits all. Some might have some of these symptoms, you know, some might have most of them. In addition to these, one of the main problems that men are concerned with that often crops up is things like a loss of libido and erectile dysfunction as well. They also get fat redistribution. They often get like a large belly and man boobs, which they call gynecomastia. They also tend to get depression quite a lot, but interestingly, in men, it quite often comes out as anger. And they're beginning to think now that because not all of the medical profession recognise that this particular andropause is a problem for some men, they think a lot of men are being misdiagnosed antidepressants when they've got depression. And men can even get hot flushes, so it can affect men as well. And there again, it's because of the fluctuating levels of extra estrogen as well. And they think that this can happen usually sort of earlier, but can it happen even when men are maybe in their 70s or 80s as well? And so this is just to give you some kind of an idea as to like the estrogen. And now, can you see like me in the corner? Do you want me to make my things smaller so that you can see this graph? I don't know what you can see.
You can see it, yeah.
Yeah, okay.
Yeah, we
so
can
this
see
is just to give you some kind of an idea as to how testosterone decreases in men. And as I said, it's much more gradual. And when men get low levels of testosterone, it can cause the symptoms that I've already mentioned, but also they get an increased risk of things like Alzheimer's as well, and osteoporosis. because osteoporosis is something that men get as well as women, and it's also becoming a growing problem as well in men. So what causes low testosterone? Can be for a number of reasons, and there again, they're not entirely sure. But if men have got maybe type 2 diabetes, if they've got liver disease, if they're overweight, sometimes things like pituitary tumors and things, if they've had radiation or chemo, or sometimes things like if they've had a high dose of steroids can set it off as well. So all of these things can mean that they have a lower rate of testosterone than they should do. Show a lower level, sorry, not lower rate. So are men aware of this? Well, I would say the short answer is no. I go to lots of networking events and things as well, mixed networking events. And basically, some men are aware of it, but not many. And there's even controversy amongst like the medical profession as to whether or not it actually exists. And as I've already said, they think it's unreported and not necessarily recognised. So I think it's possibly where the female menopause was, say, I don't know, so maybe even 5-10 years ago, and that we really need to get the information out there so that people are more aware. And if men have got a low level of testosterone, the way that it's tested is they get a blood test. So, and if it's below a certain level, then they're deemed to have low testosterone. That being said, it doesn't necessarily, if they've got the lower, even if they haven't got a lower level, they may still have some kind of a deficiency. And what they say is they may benefit from having extra testosterone, even if they have it's considered to be a normal range. Because they say it's best if men actually identify how many of those symptoms they've got. And if they've got a few of them, then they're probably going to benefit from increasing their testosterone. So there are a number of things they can do, and I'll go through the natural ones first. So losing weight is the main thing, because the fat cells actually decrease the amount of available testosterone. So if men can lose weight, that is really going to help them as well. Getting vitamin D, it not only, well, we know it helps us generally, but it also increases a man's total testosterone level. Also, when they, if they've got low levels, it can really impact their ability to exercise and strengthen things as well. So strength training actually helps increase muscle mass and levels of testosterone as well. So that's good as well. Very similar to women, they're recommended to reduce the amount of alcohol, caffeine and smoking, purely because all of those are considered to be toxins as well, and they stop their body from just working as efficiently as it could. There again, reducing stress, very similar to women. Things like meditation and yoga and mindfulness, it decreases their cortisol levels, and that in turn helps to increase the testosterone levels. Eating organic fruit and vegetables. Now, the reason for this is because fruit and vegetables that are not organic tend to have a lot of pesticides and things on them. And those are the toxics, the toxins. And they now think that all of these toxins actually prevent the normal hormones in the body. So even with women, it's better to eat organically if you can. And so they really recommend organic food and that if you can. Also, interestingly, particularly in meat, it's really good to go for a good quality meat and not sort of mass produced, because those are quite often given synthetic types of estrogen and testosterone in the animals. So that's not good for men. So if they can have I don't know, meat from like local butchers and farm shops and things. That's quite good. Excuse me, I'm just going to get some drink of water. There's also a whole range of vegetables which are called cruciferous, and they are considered to be very good as well. And they're things like kale and broccoli, tend to be like the green leafy things as well. And sleep. Sleep is another one of those things that we're all recommended just to get as women, and can sometimes be easier said than done. With men, if they are having low levels of testosterone, it can impact on their sleep as well. But there again, it's really important to get enough sleep, because that actually decreases your levels of cortisol as well. That in turn helps you to lose weight, and that again helps you to maintain more stable testosterone level. So what is TRT? So we've all heard of HRT, and TRT stands for testosterone replacement therapy. Now, depends which country you're in, can be very controversial as to whether or not men should take it or not. But then I would say that is also the case with women, to be honest. There's very mixed reviews about HRT. But there are some specialists that will prescribe it. It has got risks and benefits, as with everything, but if they do take testosterone replacement, it does actually reduce all of the symptoms, or most of them, that I said before. The reasons they were reluctant to do it is particularly if somebody's had prostate cancer. They think it may reactivate the cells and things again. So that's one of the other things. But if they are given testosterone, there are 3 ways that they give it. They are either giving it via gel. It just comes in a tube and they just like rub it on themselves. They get injections and they have to go to the doctors for these every 2 to 3 weeks. Or there are implants, which they have implanted in their buttocks. And these they have to go and get replaced every, say, 3.5 to 4 months. So as I say, there's very sort of minimal information, I would say, on this really. Some countries are really pro testosterone replacement therapy and some aren't, but it is very much a thing that I think will increase a lot in the future. So that is sort of a bit, well, that's a very, very flying overview, really. Have either of you got any questions, or anybody would like to ask anything?
I was just going to say, Shirley, that I'd read, because a lot of men suffer with erectile dysfunction later on in life, and quite often it isn't picked up that it is a deficiency with testosterone. And they are presented with the famous blue pill.
Yeah.
And that famous blue pill does actually nothing besides provide them with something that enables them to have sex. In other words, like, it allows them to get hard, but it doesn't actually stimulate them in the same way it would if it was a natural process. And also those blue pills can be actually detrimental to their health. They're provided because it is an easy answer.
And I would totally agree with that. I mean, I think they serve a purpose, but I think one of the problems is, and I know this might be a bit of a generalization, but I think men are very much want a quick fix. And they think there's something wrong with me, I need a pill to take it away. And they sometimes don't look at the bigger picture. And I think it's very much the same with women as we get older. What I have witnessed as I work with more and more women I work with, and I know from my own menopause and things like that, it's a whole, your health is linked to everything. Your mind and your body are very, very interlinked. So it could be due to things like stress, it could be due to things like relationship problems, it could be due to worrying about aging, it could be due to everything. So I think we very much need to maybe look at the preventative rather than the cause. I mean, I think lower libido and erectile dysfunction are a lot more common as men get older. And I think, looking at the research and things, I think sex becomes less frequent overall. That's not true for everybody, but overall it does. But that doesn't mean it disappears already. I mean, there are still like 80 and 90-year-olds who do still you know, have sex and things and don't have any problems. So I think it is something as well that, you know, we need to be aware of. We are very much, and what I experience as well working with ladies, we're very like ageist and sexist still as well. And, you know, and we do very much worry about if I'm this age, you know, will I be replaced by a younger version, or will my partner still like me, or, you know, I'm stressed because the children are leaving home, or how will my relationship be, or the parents are ill, or whatever. And I think we just sometimes expect a lot of our bodies, really. When our minds are like going at 100 miles an hour, sometimes the bodies can't, you know, catch up. So yeah, sorry, that was a bit of a long answer.
I think there's I've read as well that there's a higher suicide rate in over 45 men, over 45-year-old males.
Suicides, higher levels of depression. I think the depression definitely is another one that I mean, that being said, it's the same amongst menopausal women. There's a much higher suicide rate, divorce rates, all of these things are much more prevalent in those age groups. But they're only just beginning to sort of, you know, put two and two together, really.
That's why it's important for us to try and understand one another more so, because
I was just going to say, so this is my website if you did want to have a look, or if you did have an email or whatever, you know, that's my email address. And what I was going to do is, like, it's just the two of you on this evening, but I mean, if you did know anybody that was in, you know, wanted to talk to me of anything, I was just going to say, you know, you're welcome to come, and I'll do a half-an-hour chat and see if there's anything, even if I can just sort of signpost you into the right place, really. There you go. So I'm back.
I'm going to stop recording.
So